And specifically today, we're going to be discussing and highlighting the implementation of NCD injuries and mental health control programs and policies. Before I dwell into it properly, I would like to specifically recognize the Acting Director General of Africa CDC, Dr. Ahmed. I will also want to recognize Her Excellency, Dr. Carol Lebo, who is the Presidential Advisor to the President of Sierra Leone on mental health. I will as well want to recognize all eminent people that are here and those who have joined us virtually. Especially, we have members of the Advisory Committee to Africa CDC on non-communicable diseases, injuries, and mental health. And I have here seated Dr. Hassan Ghanem, Professor Hassan Ghanem, who is from University of Sousse in Tunisia. You are welcome, sir. I have here Professor Abba Wakil, a professor of psychiatry from University of Maiduguri, Nigeria. I also have here Dr. Mary Nyamogo from the African Institute of Health and Development. You're welcome, ma. I have my very good friend and brother and the last born of my family that I'm going to be working with here, Dr. Naim Dalal. He's a psychiatrist from Zambia National Public Health Institute. I recognize you and appreciate you. We all know that non-communicable diseases, injuries, and mental health conditions create a long-term public health and development challenge, especially for Africa, even though it's a global problem today. And it requires a well-coordinated continental and global response for effective prevention and control. NCDs and mental health conditions are leading to significant burden in terms of morbidity, mortality, and socioeconomic burden, but often ignored, in fact, neglected. Africa CDC, that we all know, is an autonomous health agency of the African Union, which has recently been elevated to a position of African Institute of Health, with a responsibility of tackling all health matters that is relating to this continent. So that responsibility has given them the mandate to support public health initiatives of member states and strengthen the capacity of their public health institutions to detect, prevent, control, and respond quickly and effectively deal with disease threats. The human loss from non-communicable diseases, injuries, and mental health conditions across Africa is quite significant. Today, we have come to realize that mortality data alone is not enough to justify the need for prioritization of NCDs, injuries, and mental health conditions. Why? Estimates have suggested that NCDs and mental health conditions cause over 2.1 million premature deaths in people who are less than 70 years of age, and over 204 million disability-adjusted life years across Africa. This is contained in the reports of 2019. So today we are looking at the burden in terms of disability-adjusted life years, because when you look at mortality, an illness causes mortality, you die, you go, and it's gone. But when we look at disability-adjusted life years, we are talking about the burden that you are going to constitute for all the areas of that society as long as you continue to be alive. And this has been shown to be a more important way of assessing the burden of conditions globally. Today, we have very eminent people among us and virtually that will discuss this and highlight what Africa CDC is doing. And of course, central to this are the people who are providing leadership in Africa CDC. We're expecting the Acting Director General, Dr. Ahmed, to join us on the panelist chair. We also hope that Dr. Mohamed Abdulaziz, the head of division of this particular NCDs, injuries, and mental health, will also join us. But sitting right here with us is Dr. Adelad Kakunzi. Please, I invite you to come and take your seat as a panelist. Can we recognize him, please? Dr. Adelad Kakunzi is the lead in the division for non-communicable diseases, injuries, and mental health unit, Africa CDC. I would also want to crave your indulgence to invite Dr. Kumar Mega to come to the panelist chair. Dr. Kumar Mega is the head of Global Partnerships and Business Development of Medtronic Labs, United States of America. I will also want to invite Her Excellency, Dr. Carol Lebo. Like I said, she is the presidential advisor on mental health to His Excellency, the President of Sierra Leone. Ladies and gentlemen, we have very eminent people that are going to discuss what Africa CDC is doing with regarding NCDs, injuries, and mental health across the continent. We have a strategic plan that has been developed, and I'm sure they are going to talk about it, and it's been implemented in full force. So I will start with Dr. Adelad Kakunzi to take some 5 minutes and talk to us about Africa CDC, non-communicable diseases, injuries, and mental health strategy implementation plan, the continental flagship programs for the prevention and control of NCDs, injuries, and mental health conditions in Africa. Dr. Adelad.
Thank you so much, Professor Latif, for this excellent introduction. So before my presentation on the implementation plan for the NCD injuries and mental health strategy, I would like to take the audience through the strategy itself. On that presentation was supposed to be done by Dr. Mohamed Abdulaziz, but he is now in another event, and we just join us in the next 10 or 15 minutes. Slide. But before that, I would like really to acknowledge the presence of the advisory committee member that Dr. Professor Latif presented. I would like to acknowledge the presence of different partners, starting with Medtronic Labs. We co-organized this event together. And thank you really for the excellent collaboration. This is what we want to see happening on the continent, while the private and the public are working together to advance on some of the pressing issue around NCD injuries and mental health. I would like also to acknowledge the presence of member states representative. We have here more than 6 head of NCD department from Kenya, Botswana, Senegal, Ghana, and Nigeria. So thank you all for taking your time to join this event on NCD injuries and health. And as Dr. Professor Latif mentioned, we are here really now to look at the role of Africa CDC. And I'd like to start a presentation of the strategy with this picture. This was taken in April this year, where you see representatives from almost all the 55 member states gathered in Addis Ababa to validate the NCD injuries and mental health strategy. And you can see on the front our acting director and our former director, Ambassador John. And I think that was one of his last events as our director. And this picture is really, it give me back good memories, because we really had full attendance of all the member states. And we validate the strategy during a ministerial meeting where we had 6 ministers of health attending the event to validate that strategy. Next slide. So my presentation will just be in 3 parts. I will just give a brief introduction of Africa CDC and give an overview of the Division of Disease Control and Prevention, mainly the non-communicable disease and mental health unit, and end with the presenting the strategy on NCD injuries and mental health. Next slide. Can we have it on this screen as well? Next slide. So looking at this slide, you can see the Africa CDC journey, starting at the African Union Special Summit in Abuja, where head of states agreed to have a continental body that would respond to disease outbreak and support countries on emergency preparedness response. And at that time, the initial objective was to conduct life-saving research, share knowledge, and build capacity in responding to public health emergency. And that was in 2013. And 1 year after, we had the biggest outbreak in African history, with huge and financial costs due to weak surveillance and poor public health system. We all recall the Ebola outbreak in West Africa. And this public health event added some urgency on the need to have the Africa CDC established. And in 2015, during the 16th extraordinary session of the Executive Council, they decided now to add a more objective to enhance early warning systems, coordinate and harmonize health regulation, intervention, and introduce regional center. So I'm having issues on looking at, is it possible to have it on this screen? Oh, let me just use, can I have my... Apologize for this. really apologize for this. So at that time, the session adopted the establishment resolution of the Africa CDC. And as I say, they added 8 strategic objectives that included supporting member states in preparedness and response and addressing gaps in international health regulation. And finally, Africa CDC was launched in 2017. Next slide. Next slide. So, Africa CDC in 2017 and now, you can see on the picture here the launch of the Africa CDC. In the middle, you can see the then chairperson of the African Union, Madame Zuma. You can see the chair of the African Union at that time, His Excellency President President of Guinea. You can see just next to Madame Zuma, that was the former Commissioner for Social Affairs. And if you look at carefully behind him, you can see a familiar face. That is the current WHO Director General. At that time, he was the Minister of Foreign Affairs in Ethiopia. So this is during the launch of the Africa CDC in 2017. Now, what has changed? In the course of establishing Africa CDC, we have now reached a level of having an autonomous African Union institution. And what does it mean? It means that now Africa CDC has the legal, institutional, and operational autonomy to serve as a channel to mobilize financing and build the necessary capability required, as well as acquire a vital continental asset for disease prevention and control. It means now that Africa CDC can make decisions in case there is a need for an urgent response of deploying of resources to fight disease. And it means now that Africa CDC is more accountable for the decision and policy being made to address the gaps in Africa health system. This is very important milestone for Africa CDC to really be able to perform those core component of a public health agency. Next slide. So now Africa CDC is guided by the new public health order. And what does this mean? It means that Africa CDC is now focusing on 5 core areas for the continent mid to longer term health security. The first being able to have a push for strong regional institution that will be able to guide priority, coordinate policy and program, and drive standard setting and disease surveillance. Africa CDC now is really pushing for local production of vaccine, therapeutic, and diagnostics. And this is one of the lessons we learned from COVID, where Africa, the continent were left behind in terms of first the PPEs, then the vaccine. And really want, with this pillar, to drive down a procurement cost and increase response speed. We want to see investment in public health workforce, and this also include leadership program for the public health workforce. And of course, we can't do this alone. We need to have strong and high-level partnerships, including partnerships between donors and government, and the public and private sectors, as I was mentioning at the beginning. And we also want to see a greater role of regional organization in a pandemic governance. Next slide. Now, what are the areas of work of Africa CDC? Africa CDC work in 6 distinctive strategic areas. And for your information, the first areas was operationalized right in the middle of the COVID-19 pandemic, where Dr. Mohamed Abdulaziz was appointed as the head of the Division of Disease Control and Prevention. It was there when they launched Africa CDC, but because of the urgency of the Ebola outbreak, it was not, his operationalized was deferred to a later date. And you can see the other pillars, including emergency preparedness and response, laboratory system and networks, National Public Health Institute and Research, Public Health Information System, and of course, surveillance and disease intelligence. Next slide. Now, I will really give you a quick overview of the NCD and mental health units. As I mentioned, you can scroll it up. In 2020, this is where the Division of Disease Control and Prevention was established. At that time, we had 3 units, the NCD and mental health, the community health services, and the endemic and neglected tropical diseases. We now have a 4th unit on reproductive health. And for the NCD and mental health, our priority was to develop the NCD injuries prevention and control and mental health promotion strategy. In 2020, we also hold some webinar on the mental health aspect of COVID-19 and worked with a consortium of public health institutions to look at the mental health response to COVID-19. In 2021, we received the first funding from the African Union regular budget. This is a milestone worth mentioning because this now have ensured that we are having a sustainable funding from the African Union Commission. We recruited the technical staff to deliver on the unit's work, and we enhanced collaboration with other divisions at Africa CDC and AU, and with technical, strategic, and financial partners. We also supported a research study to test and validate an African developed and owned tool concerning children's screening for depression. And we will be presenting the finding from this study later today in an event starting from 2025. So this year has been really fruitful for the units. As I say, we launched our 5-year strategy. We developed an implementation plan that we touch it later. We established a high-level advisory committee on NCD injuries and mental health to guide the implementation of the strategy, and many members today. We kick off our implementation with training of 30 senior NCD managers on evidence-based programming, evaluation in member states. We also had the regional workshop to strengthen mental health and psychosocial support integration into emergency preparedness and response. And that was done in the context of the ongoing Ebola in the region. You will see when I will present some of the flagship priority for Africa CDC, that we started with implementation, really looking at those flagship interventions. We also conducted a mental health campaign during the World Mental Health Day at the African Union, the first of its kind, where we engaged the high-level leadership at the African Union. We also developed documents for having a head of state champion on NCD injuries and mental health, and having an African Union multi-sectoral committee on those conditions. So next slide. So those are some of the flyers, picture of what we have completed. We can see the webinar we did for really helping frontline health workers during COVID-19. And if you look at this picture, you can see some of the eminent experts on mental health, Professor Soraya Sidat and Professor Oye Gureje, who were part of this excellent webinar. As I mentioned, we also developed some course on psychosocial first aid for the continent with some of the partners. And as I mentioned, we also conducted a study looking at the challenges and opportunity for mental health and psychosocial support in COVID-19 response in Africa. And we built on the findings from this study really to design the program where we want to really run with member states on MHPSS. Next slide. I mentioned the advocacy we've done around the World Mental Health Day. You can see here our acting director, who really took part in a webinar we organized to celebrate that day and really make a strong commitment for Africa CDC to promote mental health in Africa. And you can see our deputy chairperson of the African Union Commission, who is from here, Dr. Monique, also part of the campaign. Next slide. Here you can see some of the trainings, the one we did in Dar es Salaam, and the regional workshop we did in Kenya on MHPSS. Next slide. And you can see also some of the webinar we organized on NCD investment case. And the other picture is a field visit during the training in Dar es Salaam. Next slide. So now I will really quickly touch on the Africa CDC strategy, starting describing, next slide, the process of developing those strategic priorities. So we did it in 3 phases. The first was on gathering evidence through some epidemiological review, country capacity review. We did 3 country case studies, I think in Kenya, Rwanda, and Nigeria. And the second phase was really consulting member states. We had 3 consultations. The first, a virtual consultation where we invited all the member states for a 2 days virtual meeting to look at the emerging findings from the evidence gathering process and align with member states on the priorities. Then we also conducted a priority setting survey where we got a very excellent response. I think 39 countries responded, and we were able really now to move from a long list of priority to now a short list of 6 priority data we present later. We also had some internal consultation with Africa CDC division and the African Union division. And the last phase was now to consult partners, academia, experts, and seek that alignment. We also had consultation, lived experience person with the civil society organization to really ensure that the voices are heard and we are not missing we have everybody on the table. So in developing the strategic priority, we were guided by the African Union Agenda 2063, which is the guiding document for the social and transformation of the African continent. We are also guided by the Africa Health Strategy from 2016 to 2030. Of course, the preview Africa CDC strategic plan that we are now updating, and of course the essential public health function framework. And to ensure comprehensiveness and focus on public health function, we looked at those 7 areas: laboratory and diagnostics, healthcare, workforce, surveillance, governance, health protection and promotion protection, and research. And of course, we're also guided by the new public health order that I explained before. Next slide. Now, I think you all got a copy of the document, so I will not take long on the vision, mission, and goal, but I want to really take time to talk about the guiding principle. Next slide. So, the Africa CDC NCD injuries and mental health strategy is system focused. We are not prioritizing any condition. Rather, we are looking, it's inclusive of all NCDs, injuries and mental health condition, and the risk factors, with, of course, activity that are appropriate to the need and burden across the continent. This is something that is worth mentioning, that we are system focused. We are focusing on all the NCD, injuries and mental health, and we are more on health system strengthening. The strategy is also integrative and interdisciplinary, with linkages to the SDG effort to improve primary health care and quality of care, health equity, patient-centered care, community engagement, and interdisciplinary and multi-sectoral approach, as you will see throughout the strategy. The strategy is also coordinative. We seek to be complementary and non-duplicative, and we are dedicated to collaboration and coordination to achieve the best support to member states and the population. And of course, we are multisectoral. The multisectoral and interdisciplinary work have been emphasized throughout the document, within and across Africa CDC, of course, and the African Union, and looking at how to integrate the NCD injuries and mental health into existing work stream, and including a sector outside the traditional health system. Next slide. Now, I will take you briefly through the different strategic objectives. So we have 6 strategic objectives. The first is on enhancing the capacity of Ministry of Health, National Public Health Institute to develop, integrate, and implement national and supranational framework and policy for the prevention and control of NCDs, injuries, and promotion of mental health. And you can see that there is priority intervention for NCD and injuries. I will not go through each of the intervention, but I will focus on the flagship initiative, because I will come back on this later with my second presentation. This flagship initiative here is to support member states to integrate the non-communicable disease injuries into primary and secondary health care. I will touch on this later in my second presentation. So, and we have next slide. And we have, of course, priority intervention for NCD and injuries, but also for mental health. And that was one of the requests from member states, to have a standalone mental health implementation plan. And on the first objective here, flagship initiative, is to support the Ministry of Health, National Public Health Institute, to integrate mental health and psychosocial support in health emergency response. Next slide. The second objective, strategic objective, is on advocacy for political commitment to NCD injuries and mental health. And here the flagship initiative non-communicable disease and injuries is to support the adoption of a continental declaration by member states for the prevention and control of NCD and injuries. And this is, if you recall, what I was saying about developing for NCDs, injuries and mental health. This is the process now that I will also have time to describe later. But here we really want, by the end of this, the 5 years, to have a strong declaration by member states at the head of states level for the prevention and control of NCD injuries and mental health. It's the same for mental health. Next slide. But here looking specifically for the promotion of mental health. Next slide. The strategic objective 3 is on multisectoral action on NCD injuries and mental health, working with member states, of course, regional economic community and partners to establish and strengthen and coordinate the multisectoral action. And the flagship initiative here is to really have an African Union multisectoral task force that will lead and coordinate across sectors. And you can see that this is also linked with the strategic objective 2, and I will have time to also present on that. Next slide. For the mental health, the flagship initiative here is to really have a continental investment case for multisectoral action on mental health using the multisectoral task force. Next slide. The strategic objective 4 is on workforce development, where we want now to really strengthen the workforce for NCD injuries and mental health, and link them in a continent-wide network of practitioners and researchers. And here, we also have time to talk about it. We want really to establish and build on Africa CDC workforce platform to establish workforce development program for NCD injuries and mental health. But for next slide, but for specifically for mental health, we want to also have a continent-wide public mental health leadership program. Next slide. The strategic objective 5 is on ensuring that we have a sustainable continental and regional funding mechanism for the implementation of those strategic objectives to support member states. And here we want really to mobilize for the NCD and injuries, mobilize funding for setting up continental center of excellence on non-communicable disease and injuries. And for mental health, we want to secure funding for the Africa CDC strategy for the promotion of mental health and well-being. So the last strategic objective is now on ensuring that we have access to affordable technologies, medicine, and diagnostics that are required for NCD injuries and mental health, and by supporting the local manufacturer and pool procurement of this good where possible. And we call the new public health order strategic pillar 2 on local manufacturing. And we really want to, on NCD and injuries, to develop and extend a platform to enable cost-effective and pool procurement of NCD and injuries technology, medicine, diagnostics by member states. And for mental health, it's also to develop an extend platform for cost-effectiveness and pool procurement of mental health. Those are, I think, the end of my presentation on the strategy. And I see now we have our acting director in the room. So I will give back the floor to the moderator. Prof.
Thank you very much, Dr. Adelad, for this presentation on how we started, where we were and where we are, and where we are heading to. Choose this. Okay, thank you. While Dr. Adelad was speaking, we had earlier introduced the acting director of Africa CDC, acting director general of Africa CDC, Dr. Ahmed. He walked in quietly. I was expecting some cracks in the wall, some earthquake. You are welcome, sir. We also had the entrance of Dr. Mohamed Abdulaziz, the head disease control and prevention of Africa CDC. Please come to the panel, Chair. Now, I want to specifically now leverage on the mic that is in my hand to invite the acting Director General to give us his address. You're welcome, sir. This is the one that works.
Okay. Professor Taiwo, and good morning, good afternoon, colleagues, wherever it is that you're joining from. For those of us here in the room, a very good morning to you. And pardon my walking in quietly and not breaking any walls. We are hosting a lot of events, and between now and the end of the conference, you will see this indisciplined behavior of mine of jumping into a session and then jumping out of need. It is not our style at Africa CDC to do that. But this is a very important session, particularly for me. For those who know me and those who don't know, my professional life started in non-communicable diseases. And it's an area that I proudly always go back to. So when we started the journey of trying to put together a strategy for the continent, it was really the culmination of a lot of efforts over many years, and seeing that strategy approved, launched, and now in action of implementation, it's a very, very personal level, proud moment for me. So I would like to congratulate everybody who was involved in making this happen. And for our team at Africa CDC, Mohamed, Adelad, and the rest of the team, a very big congratulations for making this side event also happen. Having said that, many times when I refer to non-communicable diseases and Africa CDC, people ask, but you folks are always chasing outbreaks. Where are the outbreaks in NCDs? That's the unfortunate part, that there's a huge pandemic in literally, if you pick any NCD today, it's a pandemic on the continent. Whether it is the disease itself or whether it is the risk factors, it is a pandemic on the continent, but we don't see it as an emergency. And therein is our failure as the whole world, that we don't see NCDs as an emergency. And in fact, today I was being given the very important information of what happened in Senegal when the government decided to put up a platform where those who had comorbidities could be able to be fast-tracked in as far as vaccination is concerned. The real burden of NCDs was then seen in Senegal. If we went and counted the numbers who have hypertension, diabetes, cancer, every other NCD, the numbers would be mind-boggling. But we don't look at it as an emergency, and we need to change that. That is why, as Africa CDC, looking at the figures that are not very pretty here on the continent, looking at the resources that are very constrained, especially for non-communicable diseases, we are very focused on using the new public health order as an important platform for non-communicable diseases, mental health, and injuries to be addressed by us as Africa CDC, by the Africa Union, and the continent at large. So I would really like to invite all of us as member states, as intergovernmental institutions, as partners, to work together towards making sure that the figures that are hidden become not only obvious, but they become common knowledge to our policymakers so that the correct resources can be able to be allocated to non-communicable diseases, mental health, and injuries. It is the only way that we can be able to address the huge task that is ahead of us. When you take this and compare to the number of health workers that we have, the crisis is triple. It is that we have a lot of people, we have few professionals to look after them, and we are under-resourcing the whole area of NCDs, mental health, and injuries. So we need this data to come out clearly and to be addressed by our policymakers in a very comprehensive fashion. Let me touch on how we will approach the new public health order and addressing NCDs, mental health, and injuries. When we started putting together the idea of how do we get a strategy in place, we then realized just how much resource we had on the continent. The number of professionals who are working in NCDs is a lot. We just don't put them in a room and shout about how much resource we have. We need to ensure that all those resources, because many times when we look at our new public health order, Pillar 4 speaks of domestic resources. People immediately start asking, do you think the governments will put up the money? Resources is not just money. It is our experts on the continent. What do they know and how can it be able to contribute to our actions to address NCDs, mental health, and injuries? It is our institutions, whether they're institutions of learning, whether they are research institutions, whether they are health emergency institutions like National Public Health Institutes, national NCDs, what do they have that we can be able to bring to bear in NCDs, mental health, and injuries? We want to use our resources first before we ask for help because we have enough of that. Many times, if you don't use your own resources, the confidence in those resources drops. If we use our resources, the confidence in the local resources is also going to increase, and we are going to be able to get even more out of the resources that we have. And that is Pillar 4. Pillar 2 speaks about health workforce. And today, if you go to any small health facility, any big hospital on the continent of Africa, you'll find health workers that have gone for 3, 4, 5, 12 trainings for HIV, for malaria, for TB. If you ask them when was the last time they did a refresher course in diabetes care, they can't remember it because it was way back when they were in school. This needs to change. We have to ensure that our health workers, from the community health workers, where I'm from, the next door has a session on community health workers, all the way to the specialists. They have current knowledge, they know of current tools that they need to use in providing not just information but also care to those who have non-communicable diseases. So building that health workforce on the continent of Africa also means that we must build the health workforce that takes care of non-communicable diseases on the continent. Pillar 3, local manufacturing. You know, I like giving this example because it pains me so much. Sometimes I wish I had a little bit more money than I have today. I will start a factory of some sort. 150 to 160 million tests of HIV are done on the continent today, rapid tests. Not a single one is manufactured on the continent. Not a single one. And for all intents and purposes, HIV has become another NCD. It is chronic. Its effects are going to affect our area of work of NCDs. Any neglect, of course, will result in another NCD or the other. But that is just rapid test kits for HIV. If you go and check any other laboratory diagnostic process for any NCD, you'll find that we don't manufacture anything of it on the continent of Africa. If you go to what we need for care, whether it is in dialysis, whether it is in cancer, whether it is in hypertension, it's a very small, almost insignificant proportion of therapeutics that are actually manufactured on the continent. We have vaccines now that are addressing HPV, none being manufactured on the continent. Yet, our need is growing, 1.5 billion of us on the continent, and we are not yet manufacturing what we need. Pillar 3, we need to address that, and we need to start with the small wins. It is 2 days ago, Mohammed, that a company in the US run by a former classmate of mine saying that they have found a cheaper version of pediatric formulation for sickle cell disease, and they would like to launch it. So I said, why are you launching it in LA? And yet, sickle cell disease, your clients are somewhere else. So we are trying to negotiate how the launch will be made here in Africa sometime next year. We are not doing local manufacturing, and because of that, it continues to be expensive to manage non-communicable diseases on the continent. And finally, part of the reason we are here is partnerships. What we need to do in NCDs, mental health and injuries, is going to need more than public health professionals. It will need more than clinicians. It will need more than community engagement colleagues, whether it is social scientists or communication specialists. It's going to need everybody to come together from the very top, and hopefully very soon we'll have a head of state championing the non-communicable diseases on the continent, everything going correctly. We need it from the very top all the way to the community. Partnerships, partnerships, partnerships. And our new public health order, Pillar 5, calls for partnerships with 2 characteristics. It must be action-oriented. So as we have this session here today, Prof, as moderator, as we have the session, we must get some actions out of it. What do we need to do when we leave here? So that we don't meet and discuss and remember how nice Kigali was, and then there is nothing that is going. We need partnerships that are going to be action-oriented, producing concrete results. Those partnerships must also be based on Africa's priority. So instead of addressing a part of NCDs that may not be a priority for the continent, let's be clear what the priorities for the continent are, and we start with those. Sickle cell disease, for me, is manageable, but we have not given the thought to the pediatric formulation, so they're more accessible than they are today. And you'll see mothers struggling with the adult versions, breaking them into pieces, separating. It's very difficult for mothers to do that. And if we don't catch it early, then it becomes a crisis in a family on a very regular basis. Partnerships, action-oriented and based on the priorities of the continent. I would like to make a commitment on behalf of the Africa CDC team that the recommendations that will come out of your discussions, we are going to put them into action. So long as it is within our mandate, we'll put them into action, and we'll look for ways of mobilizing domestic resources first before we go out. I thank you.
We've listened to the acting Director General of Africa CDC, and the emphasis is on action, domesticated action, what we can do with what we have. And I trust everybody here, by the end of our sessions, we should be able to come out with something. We thank you very much, sir. I would like to invite Dr. Abdulaziz Mohammed to give a word or two.
Dr. Ahmed, just 1 minute before you go. I just wanted to seize this opportunity to just introduce some of the people that have made this possible.